Today the topic given to me is platelet-rich plasma for androgenetic alopecia. To begin with, if I have to define androgenetic alopecia, everybody must have heard about it. It is an hereditary and androgen-dependent progressive thinning of the scalp that follows a very defined pattern. This is for the men, and for women it's quite diffuse most of the times. Platelet-rich plasma is defined as an autologous concentration of plasma with a greater count of platelets than that of whole blood. One has to see, when we call it male pattern baldness most of the time, but it affects men and women equally. In men, it usually begins at the age of 20, and 50% of men get androgenetic alopecia by the age of 50 years. And women, they begin quite early from 12 years itself, and by 40 present with diffuse alopecia. This is a grading for alopecia. There are many grading formats available, but we usually follow the normal scale. This is quite simple and easy. We usually end up seeing patients from grade 2 to grade 5. Coming to the pathogenesis, this has not been clearly described so far, but dihydrotestosterone binds to the androgen receptor of the hair follicle, and the genes play a major role, and these genes responsible transforms a large terminal follicle to miniaturization and eventually loss of the hair follicle. This is a photographic description. What happens in very simple terms is the anagen phase, this cycle is shortened. Usually it lasts for 2 to 3 years in a normal hair cycle, but once this is shortened, each cycle goes by, as the shortening process takes place, the hair bud becomes very small and eventually just withers off. To explain this in a patient, this is a patient, a very young boy, actually was only 22 or 23 years old. He came with vortex baldness, and we have to see, we usually do a tricoscan to decide how bad the condition is, and here we have to see, we can see very thin hair with few spots, and few follicles are empty. And there are few thick hair also, and the surrounding hair we have to see is normal. This is just the starting stage of androgenetic alopecia, and we usually have a hair count of how many hair is present per millimeter square, and in this patient there was only 8. Indications, usually everybody must be wondering why should anybody treat this condition, because it's absolutely natural and just keeps progressing. It has got a lot of psychosocial impact on a person, which is quite unimaginable. And usually we pick up cases who are resistant to minoxidil, which are very commonly used. And bad patient compliance, usually patients get fed up of using the medication for long term. Non-responders to other treatments. There are quite a few patients who never respond to anything and just continue losing their hair. And there is a paper which has proven that untreated seborrheic dermatitis also is helped with PRP because it has got an anti-inflammatory action once it's injected. Well, directly going into how to do the procedure, first let me talk about the materials required. As you are seeing, this is the 10 ml battery container, and in this only we collect the blood sample. These are the normal insulin syringes used, and of course sterility, because the procedure has to be done in sterile conditions. So 9 ml of blood is taken into the blood container directly from the median tubular vein, and which already contains 1 ml of sodium citrate. This is then centrifuged 2 times actually, first for 5 minutes and then after that for about 15 minutes. And then the top layer which you see over here is the platelet-rich plasma. Usually in this 10 ml you get about 4 to 4.2 ml of PRP. And the middle layer over here is the buffy coat, and the lower layer is the RBC cells deposited. Well, this is a video. First, we usually sterilize the area where we need to break. We plan which areas need to be done. And this is a Lepage technique we call, where we are giving an intradermal injection of the PRP. It's done in all the areas where it's required. This patient came with anterior hair loss, more on the anterior side. This is normal 2 classification. The mode of action. Alpha-kinase of the platelet releases proteins. Platelet-derived growth factors, transforming growth factors, vascular endothelial growth factors, insulin-like growth factors, epidermal growth factors, and interleukin. These growth factors act. Hypothesis is that it acts on the stem cells in the bulge of the follicle. They stimulate the new follicles and promote neovascular adhesion. After the procedure, we usually see that the patient who has got this thinning or miniaturization of the hair follicles show better thickness and longer hair growth, and new follicles are also seen. As we go by, I'll show some cases. Here, this is the patient whom we have done earlier. He's done only one procedure. Younger patients usually do much better. Older patients need more procedures. This is another one patient who was in his 20s. If we have to see this, he's also got a type 2 type of corners. We've done one procedure for him and he's improved quite well. If we have to show you on the magnification, this patient actually had the procedure, sorry. And first he had only 4 hair per 10 millimeter square, and here he is shown 13 hair after the procedures. Usually the procedures are asked to be done at 3 to 4 weeks interval. We end up doing it every 3 months because the results are shown only after 3 months. So I've seen that if you wait for some time and do the procedure, it does help, and the results are almost the same. This is also a young patient who has done, and he's had anterior baldness. In his case also there is only the thickness of the hair is improved, and there is only one strand of hair which has increased after one procedure. But that also makes a lot of difference. Here also you can see the thickness of the hair has improved. From 9 it has gone up to 10.10, and 9 hairs to 10 hairs. This is another patient. This number has increased by 3 hairs, so you can see a lot of improvement in his number of hairs. This is a lady patient, as I said, they have diffused hair loss. And in this case, you can see the anterior hair loss is quite diffused. After the procedure, she has improved a lot. And the number of hair has actually increased by 1, but the thickness has also increased. And this is her sister, proving that genetic predisposition is very strong. She also did well after the procedures. This is another one patient who had anterior hair loss. Usually women present more with anterior diffuse hair loss and they keep spreading around. This case also, after one procedure, she's done very well. She has developed a body. The increase in number of hair has been around 3. She started with 5 and then gone to 8 hair. This is another one young patient of ours. Few more cases. Contraindication usually includes bleeding disorders, history of any past malignancies, anemia, severe anemia, that is pregnancy, nursing women, active skin disease, any active infection, and patients who have the propensity for keloids. Usually we just are very cautious about the keloids, but usually they don't develop them because we don't go very deep. Adverse effects, as far as they're concerned, PRP is immunological neutral, so it doesn't usually cause any allergic reactions or anything. Headache is a common thing which the patient experiences for a few hours after the procedure. Normal painkiller will help them. And failure of hair growth can happen. At times, when we do it very often, then this failure can happen because there's something called resistance. They tend to develop resistance to PRP if you do it very often. So that's why we give a time lapse of about 2 to 3 months for the next procedure. Infection, of course, if it's not done in the sterile conditions. So I wish to conclude saying that from a patient's perspective, it's a simple and cost-effective and a comfortable procedure. And for our doctors' review also, I would like to say that it's less time-consuming and much easier compared to the other procedures like a hair transplant or something like that. Thank you.
Thank you very much. Good talk, and I think there will be a lot of questions from
any questions? Success rate is quite good, sir. Percentage wise, we have to say usually 90% of the cases show good improvement. But yes, we don't take them as a first option and put them under the PRP initially. We usually treat them for some time and treat the other conditions which they have because they come with a lot of other problems. And usually we do low light laser also. also because many times they show a little bit of perifollicular inflammation, which has to be reduced. Once that is reduced, then the success rate is much higher.
How will be the cost?
So cost is much lesser compared to surgeries and stuff like that, but it's very effective the treatment per se. Because the cost of the vacutainer and the equipment is a little more, but then much cheaper. It's within 10,000 you can do one procedure. And it's done once in every 3 months. I think in our center we do it once in every 3 months. Because there's another one center in Pune which had done a lot of research on this, and they found that once you do it once you repeat every 3 months, then the effect is much better.
Thank you. Thank you very much.
Thanks a lot.
For the next one.